Hi everyone, my name is Joseph Mathews and I'm the practice administrator at Advanced Orthopedics and Sports Medicine, a division of Ortho Lone Star in Houston, Texas. I want you to imagine this, a hospital where the very people making decisions about your care are also the ones delivering it, your doctors. Today I'm here to highlight an often overlooked solution to improving healthcare, physician-owned hospitals. These facilities are delivering higher quality care at lower costs, and it's time we talk about why this matters. This presentation provides an overview of physician-owned hospitals, focusing on their impacts on healthcare markets, cost and quality comparisons, community contributions, and patient outcomes in the Medicare program. Physician-owned hospitals consistently outperform others on patient satisfaction, safety, and outcomes. According to CMS and peer-reviewed studies, these hospitals have lower readmission rates, shorter wait times, and fewer complications. In fact, 90% of physician-owned hospitals earn an A-grade safety rating, and patients report 20% higher satisfactions. Research out of the Mercatus Center at George Mason University in 2021 found evidence that physician-owned specialty hospitals, such as those that take care of only orthopedic or cardiac conditions, have comparable or lower costs and higher quality care. Why? Because doctors at these facilities are directly accountable not to corporate boards but to their patients. They are incentivized to be efficient, innovative, and find ways to deliver the care cost effectively. Streamlined scheduling and more personalized care coordination. Studies show physician-led organizations devote fewer dollars to administration per patient while maintaining higher satisfaction scores. Charges at existing physician-owned hospitals for 8 common procedures were one-third lower than what a traditional hospital charged in the same markets, according to peer-reviewed analysis as published in the Journal of American Medical Association. Better outcomes, lower costs. That's the real value delivered to patients. Physician-owned hospitals are associated with lower mean Medicare costs, fewer complications, and higher patient satisfactions following total hip arthroplasty and total knee arthroplasty than non-physician-owned hospitals. Physician-owned surgical specialty hospitals outperform other hospitals in Medicare value-based purchase program when evaluated for outcome measures, cost reductions, and patient-centered assessments of quality. Total savings associated with physician-owned hospitals is $13 billion over a 10-year period, according to the Avalon Health Economic Study 2013. Physician-owned hospitals strengthen communities through high-quality care, local investments, and meaningful financial contributions that support long-term community health and growth. Critics have raised concerns about cherry picking, the idea that physician-owned hospitals selectively admit patients who are healthier or have better insurance coverage while avoiding those with complex conditions or lower paying plans like Medicaid. In 2007, to overcome concerns of cherry picking, the Centers for Medicare and Medicaid Services introduced payment adjustments to account for the higher cost of treating sicker patients, reducing the financial disincentive to provide complex care. And unlike nonprofit hospitals, these hospitals contribute substantial property, sales, and income tax, supporting local and state economies. So what's the catch? Federal law, specifically Section 6001 of the Affordable Care Act, has made it nearly impossible to build or expand these hospitals. That's right. A hospital can own a doctor, but a doctor cannot own a hospital. Why? Not because of patient harm, but because of corporate lobbying and special interests. Hospital mergers and market competition directly shape patient access, healthcare costs, and the overall quality of care within our communities. Multiple studies have demonstrated that hospital mergers in the same market yield higher prices, in some cases 10 to 40% higher, and the prices continue to increase for at least 2 years after the merger is completed. Competition leads to higher quality and lower costs. With the artificial reduction in competition and continued rapid rise of hospital mergers and consolidations, healthcare costs will continue to rise. Access will become even more limited for those most in need, and quality, at best, will remain inconsistent. In conclusion, physician-owned hospitals are a proven model. Better quality, lower cost, more accountability. HR 2191 and S 1390, known as the Physician-Led and Rural Access to Quality Care Act, were introduced in the House and Senate respectively in March and April 2025. They aim to modify Medicare's physician self-referral rules to allow physicians to own and operate rural hospitals under certain conditions. They would permit physicians to own rural hospitals as long as the facility is more than a 35-mile drive from a main patient campus or critical access hospital. It would also lift the severe limits on expansion of existing physician-owned hospitals so that they can grow to meet the needs of their patients and communities. H.R. 4002, the Patient Access to Higher Quality Healthcare Act, proposes to repeal the ban on new physician-owned hospitals and restrictions on existing ones, which were established by the Affordable Care Act. It's time to lift the ban. Let them grow, because patients and our healthcare system deserve better.